Is depression biologic or psychologic? Dr. Brooke here. This is Cook with Dr. Brooke, where we talk about the connection between nutrition and mental health outcomes, but we also get into other mental health topics too. And so today we're going to go through a little bit of a history lesson. So if we think all the way back to Sigmund Freud, the first psychiatrist, he theorized mental illness as being primarily psychological. Now, Sigmund Freud got a lot of things right, and I do want to give him credit for validating the field of psychiatry, for saying mental illness is real, that it's important, that we should be addressing and treating these conditions. And he felt that the best way to treat psychiatric conditions was through psychoanalysis, people laying on the couch and processing their thoughts and memories. And he said, there's intrinsic psychological things that are leading to all these symptoms of depression, of anxiety, of psychosis and hallucinations. And if we just unpack what that thing your mom said to you when you were a kid was, or if we unpack some of these intrinsic thought patterns and belief systems and sort of got into your inner workings and figured out your psyche, we can treat your symptoms. And many people were helped with psychoanalysis. And we thought for a while that psychiatric conditions were really psychological, intrinsic, it's in the mind. And then the pendulum swung and we came out with medications for conditions. We came out with antidepressants, we came out with antipsychotics, and we saw symptoms really improve. And many people responded to and were feeling better with a biologic intervention. And then the field swung with that change and said, we were wrong before. We thought it was psychologic. There was just we got lucky on a few cases, but wow, actually it's really biologic. We'll figure out what the pathophysiology is. We'll figure out what is happening biologically and come out with treatments. And that's how we're going to cure people. And a lot of people benefited from these treatments too, but they're not perfect. And people don't always respond universally to biologic interventions. And even some people who maybe do get their meds in a great place and their mental health is doing well, that can really get rocked if their mom gets sick, if they lose a job, if there's stress in a personal relationship, like conflict with a friend, if there's a global pandemic, if there's big changes in their stress levels and in their environment, then they can still get worse, even though the biology hasn't changed. So we are now at a place where in the field of psychiatry, we consider most psychiatric conditions to be what we call biopsychosocial, which is a long fancy word for saying multifactorial. So biopsychosocial theory says that yes, there are biologic contributors to mental illness. What are your genetics? Do you have a head injury? Are you drinking too much, smoking too much cannabis and weed? Are you, is it really dark outside because you live really far north or at an extreme latitude and there's not enough sun, so your circadian rhythms are thrown off and you're vitamin D deficient? Like, are these biologic changes happening in your body? And then biopsychosocial theory says there's also psychologic pieces. So what are your coping skills? Like, do you have a trauma history? What are those internal gears and things that Freud was unpacking, and how is that affecting your mental health? And then the social piece. So the environment. Did you lose a job? Is there a global pandemic? Is your dog sick? Like, these things can also affect your mental health, even though it doesn't really affect your psyche and it doesn't really affect your biology. They can still be contributing factors. So it's biopsychosocial. It's a lot of things going on at once. The good news about this theory is it means that we can choose treatments that are biopsychosocial. So biologically, are you on the right medications? Are you getting good sleep? How is your diet? Psychologically, are you engaged in therapy? What kind of therapy? Is that a good fit for you? And socially, like, what are those environmental stressors and what can we do to be addressing and managing those best? And we have the best outcomes when people address all of these. People do better in therapy when they're on the right meds. People taking the right meds do better in therapy. All of this can be interwoven. And I talk about nutrition on this channel a lot because I don't get enough time in my clinical practice to talk about it with patients. So this is my opportunity to say that nutrition is important. It's a biologic intervention, right? We're making sure that you're getting those right building blocks that your brain and body needs to be doing its best. And it's also a psychological intervention. So there's a component of behavioral activation when you change your diet. There's a mindfulness component if you're preparing your meals. There's a lot of positive sequelae that can come from changing your diet. If you are somebody who's been watching this video the whole time, it probably means that you care a lot about your own mental health or somebody else in your life that is important to you. You care about their mental health. I hope that this channel can be a good place for you to find information and content from a well-verified source where we talk about that connection between nutrition and mental health. And sometimes we have little history lessons and sometimes we talk about other topics. But I hope that there is material here for you to engage with and that you can benefit from. Take care of yourselves, guys.